This procedure video will take you through how to aspirate a simple pneumothorax, such as that seen in the X-ray above. This could appear in the MChem OSCE examination as a procedure outright, or as an example of a station where you would have to explain a procedure to a medical student. Though this may be a relatively straightforward procedure that you may have performed in the ED many times before, it is important to be as thorough as possible in the examination. Take some time to familiarise yourself with the equipment seen above and for the anatomical landmarks necessary for this procedure. Finally, before even viewing this video, it is important to have a good understanding of the BTS guidelines for the management of a spontaneous pneumothorax. Begin by identifying your anatomy and cleaning the area.
Mid-clavicular line. I'm going to clean the area with some suitable cleaning fluid.
Next, infiltrate local anaesthetic down to the level of the pleura.
I'm going to infiltrate underneath the skin and then all the way down to the pleura.
Having given your local anaesthetic a good period of time to take effect, re-identify your anatomy and insert a large bore cannula into the second intercostal space, mid-clavicular line. When the cannula is in the correct location, air will be able to be aspirated freely. Now remove the syringe and needle from the cannula, ensuring that the cannula is anchored securely. Then attach a three-way tap. By placing a three-way tap on the end of the cannula, a syringe can now be used to aspirate aliquots of air and allow you to then discard the air without having the fuss of taking the syringe off every time. It is important to attempt to remove as much air from the pneumothorax as possible. If it becomes difficult to withdraw back on the syringe, this may be a good indicator that you have removed as much air as is possible from the pneumothorax. Having removed as much air as possible, remove the syringe and apply a clear dressing. Reassess the patient clinically and offer analgesia where appropriate. After a period of time, the patient will now require a further X-ray to reassess re-expansion.